Hi, this is Megan Friedman with Hearst Connecticut Media. I'm here today to get some readers' medical questions about the coronavirus answered. I'm speaking with Dr. Ryan Steele from Yale University. He is an assistant professor of clinical medicine and specializes in allergy and immunology. And he's going to help answer some of your questions and also talk about common myths around immunity and the coronavirus. So the first thing I just wanted to kind of start with, and I actually brought up this with a different expert a few weeks ago, but I know that, or my understanding is that the research is already changing. So something that's on a lot of people's minds is whether if you get COVID-19 and you recover, do you have immunity? And I was wondering if you could speak to the latest research, and do we even have an answer to that question yet?
So that's a great question. I think that we've seen two things that have been really out in the media recently. One is that we've had this new antibody test, and people may have heard about something called immunity passports, which has been a concept where people who have recovered from the virus are given these passports and would presumably they'd be the ones to get back to work first, because we know that from most viral infections that at least for a period of months to maybe a year afterwards, the chance of reinfection is very low because your body makes antibodies which will help to recognize the virus if you encounter it again, so that you should not really become infected a second time, or if you do, it should be a much more mild case. The other thing that has been in the news lately has been patients who have tested positive after they've had a recovery
Yes.
from coronavirus. So we think that once patients recover, they do to some extent make antibodies just like any other virus. Coronavirus itself is a family of viruses that's not new. This is a
Right.
very common family of viruses, and we know you make antibodies against them after you have an infection. The cases where patients may have been either reinfected or worried that they didn't clear an infection may just be the nature of the test, where we still have genetic material that is being cleared from our body after the virus has been really clinically eliminated. But we don't know enough yet. We're still looking at reports from South Korea and now some out of Europe from these recovered patients. But I think that Dr. Anthony Fauci really spoke well when he said, there's no reason to suspect that this is different from other viruses where the vast majority of people will have made an immune response and will be protected for some degree of time. We just don't know how long that is yet.
Well, that's good to hear because I saw those reports from South Korea, and I think what they said was they suspected it was still shedding or getting reactivated. It didn't mean that they were reinfected.
So when we look at the test for coronavirus, we really have to look at what are we looking for in the test. What we're looking for is the genetic fingerprint of the virus. So when you look for this genetic fingerprint of the virus, it's not telling us how many actual active viral particles are in the body. It's just looking for this evidence of the genes, amplifying them, and where that's something that's kind of may just be debris, or it may be actively replicating virus. We really don't know yet, but we would expect that you would probably, for some degree of time, have a evidence of the virus, even once someone is not necessarily infectious anymore.
Okay, and so you had mentioned that this is a novel coronavirus. Obviously, we've seen other diseases caused by other strains of coronavirus before. I think SARS, for example. But one thing that I'm wondering is whether people might have, maybe in different age groups or different parts of the world, might have immunity to this coronavirus because of exposure to others. Does that make sense?
That's a great question. And, as you were talking about coronavirus, SARS and MERS were two coronaviruses that we have seen that there are certain similarities between them. And in fact, some of the drugs like remdesivir, which has been one of the antivirals that has been used experimentally, and its use is really spreading, has shown some promise, was originally used to treat other coronaviruses. We think that the antibodies that people have probably developed from there are not completely what we call neutralizing, meaning that each virus has enough variance between it that we don't see that those antibodies will completely protect somebody, which is why we call it a novel coronavirus. You can kind of think of it like year to year, influenza changes enough that although you may have some protection from last year's strain, you still need to get that yearly and seasonal flu shot to really protect you in that next year.
Okay.
So I think that as we get more and more data and we look at the people who have recovered, there could confer some level of immunity, but there's not enough that we can rely on what we call herd immunity, meaning that a
Right.
great majority of the population already has enough neutralizing antibodies to protect people who haven't seen the virus before.
Got it. And then the other thing that I thought of, and this question actually has come from a reader, but when you mentioned people testing positive after testing negative, what about people who maybe haven't been tested yet and are getting tested? How do you know whether there's not a false positive or a false negative? Is there any data around that yet? And how reliable testing is, I guess.
So I think that testing itself is very reliable in terms of when you do the test, the ability to pick up the genetic material that's there is pretty accurate. We have so far about a 3% false negative rate reported, when you look at the average of a lot of the studies. But what's important is when in the patient's infectious, in the life cycle of the virus or in the infection, are you looking for it? Because early in infection, there may not be that viral or genetic fingerprint that you're looking for.
Okay.
And so those may account for some of the false negatives, whereas a few days later, someone may test positive.
And is it, go ahead, sorry.
Oh, no, I just want to say on the flip side, when you look at the false positives, that's what we talked about earlier, where someone may be shedding the virus or leftover genetic material from it, even after the infection has been cleared.
And in that case, are they contagious?
So we think that for the first question of, is someone who tests falsely negative or someone who tests negative, can they be contagious? The answer is probably yes. We see that the vast majority of infections are probably coming and spreading during the asymptomatic phase. So I think that it's a great confirmatory test, but people who have the signs and symptoms, including things as what would be considered mundane, like loss of taste and smell, those may be what we call the really kind of super spreaders who are able to facilitate the virus's spread to other individuals when they themselves are not having symptoms. On the flip side of that, the patients who are testing positive after they've had a clinical recovery, just because they're positive does not necessarily mean that they can spread it. But it is better to play it safe and to still assume that while you're testing positive, those patients are infectious. So all precautions should still be taken. And you can look at the CDC and the World Health Organization for recommendations about, when to get back to work.
Okay, so the sort of mixed or not unreliable results, but the inability to know whether you are contagious is one reason that, for example, leaders are stressing that it's important to just wear a mask no matter whether or not you have symptoms. Is that accurate? Not just to protect yourself, but others?
So the mask issue was one that, has radically changed since the recommendations early on in starting around March. But the purpose of the mask is twofold. In the healthcare setting, where we are looking at the issue of respirators, where a respirator is something that's actually filtering the air that you're taking in, and most commonly the N95 respirator, that is something where healthcare workers are wearing them to protect them from other people who have the virus potentially to be filtered out from coming in. In the case of wearing a mask in public, it really only works if the majority of people are participating in wearing a mask, because most of these either cloth masks or surgical masks that you see, they're not going to filter out aerosolized particles, meaning things that are hanging out in the air. They really are for either droplets, so things that are spitting or when someone's sneezing, but importantly, they will catch the majority of what you are expelling. So even though some can come out the sides and they fit with varying degrees of tightness around the face, but if everyone is wearing them, it will certainly help to spread it from you coughing and spreading it onto other surfaces and other individuals. So I think it is something that certainly, well, it does not offer near 100% protection. The more people that do it, it will help. That combined with social distancing and washing your hands is really the best thing that everybody can be doing right now.
So the virus spreads through droplets, and I'm wondering, as well as readers, how long those droplets can stay in the air. I assume that varies also depending on whether you're outside in the wind or you're in a closed environment. But would you be able to speak to that a little bit?
Sure. So we see that if it's in outdoors, there is differences in air patterns, in humidity, versus if you're indoors with recirculated air, it can stay for hours. So that's where we're worried in something like in a hospital environment where, or an office where things are basically hermetically sealed and you have a dry air and not a whole lot of airflow, it can hang out for quite a while. But I think that the key is really that we worry about it inoculating when it's really on the person-to-person transmission. And if you're running outside, I know that, there have been recommendations that people need to stay meters and meters away from everybody else because it can go 30 feet. I think that we have to be reasonable with our precautions, and that if you are maintaining the 6 feet, if you are in an area that's not well ventilated, try and get it well ventilated. That's really something that we are able to do on a case-by-case basis. In the hospital, it's a more controlled environment, and we have to, that's why we're wearing the respirators.
And in terms of other ways to protect yourself from the virus, obviously your just typical mask is more meant to protect others, as you said, but we do have some readers asking whether, for example, taking vitamin C every day is an effective way to keep yourself from getting the virus, or if you get it, from becoming severe. So I was hoping you could speak to that point as well.
Sure. So at this point, we do not have any proven therapeutics that are recommended for the routine treatment of COVID-19. However, there have been clinical trials, which are now numbering in the hundreds, that are looking at increased doses of vitamin C and some other vitamins and minerals in addition to antivirals and anti-inflammatory therapy. The role of treating just with high doses of vitamin C at home, I wouldn't recommend that right now. I think that it's something where if you have a known vitamin or mineral deficiency, like if someone has a known vitamin D deficiency, making sure that you are supplementing, or if someone is pregnant, taking your folate and your prenatal vitamin, those are all things that you should be doing. But optimizing your health and making sure that you reduce your comorbidities by losing weight, by making sure that we're not just sitting at home and watching streaming services all day, getting out for a walk, making sure you're exercising for at least a half hour to an hour a day is really the best thing that you can do. I would say if you're going to make any lifestyle change, we have seen that a lot of the patients who have ended up in the ICU are patients who have a body mass index greater than 30, which is in the obese range. And anything you can do to decrease your body mass index will decrease the inflammation in your body, will decrease the work that your lungs and your heart need to do to pump blood and to make sure that you're exchanging gases in your lungs. So those are things that we can absolutely all be doing to try and get healthier while we're at home.
And there may be some people who are afraid to go outside. So I wonder if you could just reiterate your earlier point about, the cost benefit. If you go out and have an outdoor walk or hike, maybe that's actually better for your immune system than if you, it obviously depends on each individual case, but
sure.
Does that make sense what I'm saying?
So if you have a backyard, don't be afraid to wave to your neighbor across the yard, maintaining your 6 feet, and you can go outside, exercise outside. I would not recommend, group hikes. I would not recommend, running next to anybody, but if you're going for a walk in your neighborhood, I know in our neighborhood, people, the streets are pretty empty.
Hmm.
So, if you're walking and you are out, just put on your mask, groups of people, and stay away. But absolutely, don't forget that most of these streaming services, like even Amazon, has exercise videos at home, and yoga, and Tai Chi, and high intensity interval training. You can be surprised how fit you can get in your living room just with a rug and body weight exercises, and you don't need a treadmill or Peloton or anything to do it. So I think that's something that everyone can be doing daily.
Got it. Some folks have also asked about other vaccines and whether there's any data that shows that if you have gotten a flu shot, you're less likely to die from COVID-19, or if you've gotten a pneumonia vaccine, which I'll be
Mhm.
honest, I actually didn't know existed or hadn't thought about it before this question was asked. Could that increase your chances of survival? Um, I mean, my guess is that we just maybe don't know, but I was wondering if you could share whatever you do know
So
for our
that's actually a
readers.
very interesting question, because so the question of whether influenza vaccine or pneumonia vaccine, do we think that would have any effect on this coronavirus? The answer is probably no. I say
Okay.
that as a qualified no, because those rely on your immune system making a specific response to the very things that will recognize that bacteria or those viruses. So those are really very specific to those infections. There is a vaccine that is given very commonly outside the US for tuberculosis called the BCG vaccine, which some people may have seen. And this is a kind of vaccination with a cousin of tuberculosis, that it's not because this tuberculosis has anything to do with coronavirus, but what it does is it does prime the immune system to respond more effectively to certain infections. And it's currently a still controversial area of research whether individuals who have received the BCG vaccine may have some decreased severity or may have some enhanced ability to fight this coronavirus.
Huh, that's
But
really
this is not a
interesting.
commonly administered vaccine in the US. This is usually given outside, where area where tuberculosis tends to be more common.
Right. Is there any talk of distributing that vaccine in the US because of the new circumstances, or not
So
really?
not as of yet. I think that really and again, I don't think people should be rushing out and asking for the BCG vaccine. It's not readily available in the US. It's just an active area of research. Where
Mhm.
we really need to look for is vaccine for this specific, coronavirus, where, SARS-CoV-2, which is the virus that causes COVID-19, is the disease caused by SARS-CoV-2 is the viral name. So that'll be what the virus vaccine is. And that's really the area where we're looking for. And that's going to be, realistically in the 12 to 18-month range, I agree, for general use. And that's something that is going to be the game changer that everybody's talking about, that could bring life back to some semblance of what we knew before, where you can really get that kind of herd immunity, so that the vast majority of people that you encounter are immune and we don't have this community spread.
Right. So to that point, it's maybe completely impossible to predict the future. I know, but many are wondering. People want to know, what are the odds that the virus dies down by the summer? What are the odds that it dies down by the fall? Um,
Mhm.
it, Without asking you to make a very specific prediction, there's obviously all sorts of models looking at when we might be able to go outside or reduce social distancing. What factors, what would have to happen for life to sort of return to normal, or as normal as it could be? What are the chances that we'll be better prepared in 3 months, 6 months, a year to resume, to stop having to wear masks and resume get social gatherings and things like that? And is that dependent on a vaccine, or are there other things that could help?
Sure. So I think that there's multiple models that are out there, and some more optimistic than others. And I think that we have to stop thinking about this as maybe temporary measures and think about this as more like, lifestyle changes,
Mm-hmm.
because I don't think this is going anywhere anytime soon. We will probably have periods where, yes, certain areas of the country will be able to get back to some semblance of normal sooner than others. And that will really be dependent on the new cases that are coming out, whether social distancing has been implemented and we start seeing that flattening of the curve. And all the flattening of the curve means is you're not stopping all infections. You're just spreading out over time the amount of new cases and decreasing the rate of transmission and stabilizing it, so until we develop that vaccine or more effective therapeutics. And it's really the vaccine and therapeutics that will kind of break the back of transmission, where we can just treat those isolated cases that come up. But I think we can expect that this will be with us for the foreseeable future. And although there may be decreases in warmer weather and with humidity, because we do see that with increasing humidity and warmer weather, other viruses do tend to decrease their transmissibility. But I think that this is something where we need to be prepared for waves, where it may decrease in one area of the country, but other areas of the world or country where it flares, those individuals can come back, reinfect the places where it had gone down. So we may have this periodic quarantine, calming down, relaxing of social distancing, coming back. We can expect that this will probably happen. I think that we need to get used to that as kind of a new, as a new normal. Not to mean you can't go on with your life, but things like handshaking, wearing masks in public, maybe not sitting next to everybody on the subway, making sure that you wash your hands routinely. If we even did those things without coronavirus, we could severely decrease the transmissibility of influenza and the death from flu. So I think those are things that we should just make part of our world of better hygiene practices. So hopefully that will be one of the silver linings in this.
All right. So now I'm hoping we have some, really specific questions from readers that they've hoped to get answered. So this one is pretty specific. I'll read it out to you. And obviously you don't know this person's specific case, but any general response you can give would be great. So this reader says, in November of 2018, I was diagnosed with Guillain-Barré syndrome. I don't know if that's the correct pronunciation.
Guillain-Barré.
That was not that Guillain-Barré. My French teacher would be very upset right now. An autoimmune response that left me paralyzed, among other things. Very fortunately, and with a long period of rehab, I'm quite a bit, not 100%. My blood pressure, usually normal, had skyrocketed, but I did not need the respiratory support of a ventilator. Fortunately, I'm now walking independently and building my stamina, returning to work with part-time hours to build endurance. I am well past the acute stage of GBS. My question, and possibly that of others, is, does this cause me to be at more risk of contracting or developing a severe reaction to COVID-19?
So you're right, that's a very specific question. And I think that a very valid question. And really to fully answer it, obviously you have to be the patient's physician to really read their medical history. But I will say this, that, and for anyone who's not kind of familiar with that disease, basically it's a disease of temporary paralysis that can occur after typically either a respiratory infection or a urinary tract infection. And oftentimes we worry about paralysis of the diaphragm, which is kind of the muscle of respiration. And some of those patients, as was mentioned in the question, can end up on ventilators. A few patients do not fully recover, and they do have residual paralysis. So my concern would be if somebody has any pulmonary compromise, if they have any diaphragmatic paralysis or their accessory muscles, like the muscles in the chest that help them breathe, are still paralyzed, then it is a potential that if you are affected with this virus, which we know has severe respiratory complications, that somebody can be more vulnerable. But I would say that really is something you need to talk to your own doctor about to see, are you considered part of the vulnerable population? We don't yet know whether this virus will have manifestations of GBS, is just the way of saying it for short. Mm-hmm. We do know it has some neurologic complications. There's been some reports of encephalitis, some swelling in the brain, but we don't know all the complications that can manifest in the nervous system yet. Loss of taste and smell is one of the most recent neurologic manifestations we've seen from COVID-19.
Okay. And then another question that actually a few readers have asked is about paper products. You know, people ask, is it safe to be getting and reading the newspaper or a magazine? I know that there's a lot of different. How long the virus can stay on a surface really varies by surface. But is that a high risk? Are paper products something that's high risk, or that people should worry less about? And what precautions should they take if they are getting the newspaper delivered?
So we know the biggest risk is still person-to-person transmission
Mm-hmm.
from droplets.
Mm-hmm.
And on surfaces, the ability of coronaviruses to survive depend on the type of material. We know that on plastics, it can survive for several days. It can survive from 5 minutes to 5 days, depending on the strain, on different paper and cardboard. But usually, if you let something sit for about 24 hours, if you throw away the plastic, I think, so if the newspapers come in plastic, throw it away, wash your hands. I would say practical advice would be don't put the newspaper onto the dining room table. Don't leave it on top of the toilet in the bathroom or any shared surfaces.
Yeah.
And after you read it, make sure you wash your hands. I think that would be, the same would go for, I know even in our house, just the mail gets opened, take it out of the envelope, goes in the garbage can, wash your hands. I think those are things that are quite practical. Don't lick your finger and turn the page in the newspaper. Things like that are...
Don't put it right up to your face.
Things like that are generally a bad idea. And, digital editions are also a good thing as well, if you're, reading online.
Got it. And then one last question that I'll ask before we wrap up is, one reader asked, should I be taking an ACE inhibitor during this pandemic? Does it make me more susceptible to COVID-19?
Sure. So ACE inhibitors and kind of their cousin ARBs, angiotensin receptor blockers, are two very effective and very common high blood pressure medications. So this was a concern very early on because the receptor, so when the virus comes into your body, the first thing it does is it kind of needs to latch on to a cell to infect you. And one of the things it does is it latches onto something called the ACE2 receptor,
Mm-hmm.
which is the kind of key lock to get into the cell. And when you take these medications, it increases this receptor in your body. So we've kind of had mixed recommendations at first where we were thinking, okay, maybe these patients should be switched off of ACE inhibitors and ARBs, or now there's even questions of, can it offer some protective effect? Most of the professional societies, and again, everyone should talk to their own doctor to determine their therapy,
Yep.
But has been, if you are indicated to be on this medication and it's been effective, not to change your therapy. Now, if a patient is actively infected and admitted to the hospital, might their blood pressure medication change? That's going to be up to their care team, and how they're doing. But in general, the recommendation from most of the professional societies has been, to maintain your current blood pressure regimen if you're doing well on it. But absolutely everyone should be speaking to their own doctor about that.
Got it. Before we wrap up, I also wanted to ask whether there are any specific points of information within your expertise that you think it's really important for the public to know, any misconceptions you're hearing that you'd like to address just generally.
Sure. So, I think that one of the things which I already spoke about, kind of optimizing your health at home is three things, really. One, make sure that you have ample supplies of all of your routine medications. If your doctor, I know I'm writing my patients for, 90-day supplies to make sure that they can really minimize going out to the pharmacy for those trips. The second thing would be, if you are able to work from home, absolutely do so. I think that's something that we can really kind of, minimize the transmissibility. And the third thing is a recommendation when it comes to alcohol, which is something that the World Health Organization has just recently addressed. The big myth that, alcohol can kind of kill this virus. Well, if you use 70% ethanol in a spray bottle to clean a surface, yes, but ingestion of alcohol is not going to have any positive effect. In fact, ingestion of alcohol will decrease the function of your immune system, leave you more susceptible to the virus, and all the other complications that can come from drinking too much alcohol are something we want to avoid, especially while you're, at home, and it can have an effect on blood pressure, on your heart, and aside from all the psychological and depressive aspects of it as well. So it is not going to kill the virus.
Okay, thank you for making that point. And thank you so much, Dr. Steele, for joining us. It was hugely informative. And I think, I hope that we got a lot of people's questions answered, as well as some of my own. Thank you.